I think the previous talk has set the base for the next talk is what I feel.
So for this next session, I would like to invite Dr. Venkata Krishna Rao, consultant physician and diabetologist at Synergy Diabetes Clinic, Bengaluru, along with Dr. Shivam Srivatsa, consultant physician and diabetologist, Bengaluru, managing director, SS Healthcare and Wellness, head tenant Diagnostics, Marathalli, and Director Rakum Blind School, Bengaluru, and Director Medical Services, Thea Life, USA. We welcome you, doctors.
Thank you so much to all the dignitaries. So now I would like to call upon Dr. Santhosh Olety to talk upon type 1 diabetes challenges, choices, and the solutions. So he's a consultant and an pediatric and adolescent endocrinologist at Pediatric and Adolescent Endocrinology Hospital, Bengaluru. So welcome, Dr. Santhosh. Over to you.
Thank you for that kind introduction, and thanks to chairpersons, and I know Dr. Venkat personally. And thank you, Dr. Manohar, and the entire team of Disha for inviting me and making a part of this platform. And I was very pleased to see the previous speaker talking about educational stuff for basic things which like insulin injection techniques, which we're still away from many miles to achieve our goals. So my talk is, I'm not going to impart any knowledge here, but I'm just going to share what services we have improved over the years to improve our holistic care for children with type 1 diabetes. So when we say about type 1 diabetes, it's not just insulin, it's a lot of things behind that. And I'll be sharing some of the challenges, what are the choices and solutions as we take this journey for last few years. So type 1 diabetes roadmap, we know 3 levels: global level, our national level, and local level. Globally, it's the International Society of Pediatric and Adolescent Diabetes and International Diabetes Federation, Life for Children. I will not be talking about what things been done, work been done at global level, but I'll be focusing more on national level and what we locally done with our institute. National level is what the ISPE, which stands for Indian Society of Pediatric and Adolescent Endocrinology, RSDI initiatives, and many other societies been done here. And locally, our Karnataka RSDI, and more specifically, I'll be talking about our institution services, which we have done last few years. So when we talk about the aim and objectives for type 1, it is the comprehensive care, which is to provide the best of care to all and to give the best quality of life, and not to deprive any child from standard holistic diabetes care. And this we do to make sure that every economically underprivileged children should get access to the basic life-saving medicine, which is the insulin. No child should die because of non-affordability of insulin. And overall, we have to bring up the child's well-being, prevent long-term complications, and make them a better citizens of our country. So, as you all know, type 1 diabetes, or even in general, diabetes itself is becoming very rapidly increasing in globally, and also especially in our country. So when we precisely look at the type 1 diabetes in our country, we have around 9.4 lakhs reported in 2025 IDF Atlas, of which almost 1/3, which is close to 3 lakhs, less than 20 years. And recently, the type 1 diabetes index, which is a simulation data released in October 2022, showed that around more than 8 lakh people with type 1 diabetes were missing, which either they have died undiagnosed or early after diagnosis. And they say that average 42 healthy years is lost per person when they're diagnosed at the age of 10 years. So this is the situation currently. So what issues we face when we are managing with type 1 diabetes? Well, we always talk about this, and most of you are already aware of this. So there's lack of awareness and inadequate health personnel, especially the specifically pediatric endocrinologists or the diabetic physicians who are specialized in diabetes and looking after the children. And most importantly, I've highlighted is pediatric diabetes educators. This is what we are lacking in our service or the team. I mean, very few hospitals might have a dedicated educator, but not every center might have. And as a physician or a clinician, it's very difficult to carry on the counseling which happens for hours together with every newly diagnosed patient, and physician burnout is fatigue is very common. So you need a diabetes educator who can spend quality time with the family to educate them. Mental health specialist, and we know that in the last few years, the approach to optimal insulin management has changed or evolved from pre-mix or twice a day insulin to more of basal bolus insulin. Although there's a significant improvement in this transition, still we see a lot of children being given twice a day insulin or a premix insulin, which is suboptimal, and we won't be able to achieve a good quality of diabetes control. And a lot of children don't do blood sugar monitoring because they're not aware of it. And inadequate diabetes education, which is the most essential pillar of diabetes management. So we need a structured diabetes educator, which is vital to pediatric diabetes, which reduce the acute and chronic complications. And we know that training our nurses or dietitians, in-person training can be expensive and time-consuming and very difficult to appease them to come for the training and get certified. And there is variable healthcare systems in our country, and around 80 to 90% is from out-of-pocket expense. Inadequate insulin and other diabetes care supplies, and diverse culture within our country with different food habits and literacy levels and socioeconomic status and school support. These are the so many challenges when we look into our families. So to address this, last year, one of the students who was 17-year-old, she was in second PUC. So she took her interest and started reaching out to us and community medicine department from Ramaya. So we looked at this study, which is a qualitative study, looking at invisible inequities in type 1 diabetes care in India, and specifically in Karnataka. So this was a qualitative study looking at focus group discussions or interview-based discussions. In-depth interview discussions. So participants were 10 people with type 1 diabetes, aged 5 to 23, 13 healthcare professionals and senior officials and policymakers. So it was an urban setting and both rural setting. Analysis was thematic, and it was after the ethical clearance. So what we found was key barriers was policy gaps, poor integration into the national framework. Insulin access was erratic supply, high and mostly from out of pocket. Healthcare training, insufficient expertise. Rural disadvantage, we all are aware that there's less infrastructure, limited services, and financial and emotional strain for the caregivers, and social stigma and gender disparities. So recommendations from this was we needed a dedicated type 1 diabetes policy within our non-communicable disease program. Subsidized insulin schemes, expanded primary health care with digital health integration, training programs for HCPs, that's what the previous speaker was also insisting, community support systems, and addressing the financial and gender disparities. So next few slides, what I'm going to talk is how we've addressed these different challenges with whatever the solutions we can. So we have done a lot of small little things, and we have crossed a distance, but we are yet to achieve a lot of things. Whatever I'm going to talk next few slides is not to glorify ourselves, but to show some pride in our progression. So we all know how COVID crisis taught us how to adapt and overcome those crises into solutions. That's what we did. Transform the crisis to opportunities, challenges into solutions. And we started extending and seeking help from a lot of other people to build a child-friendly infrastructure, reduce financial burden where possible, and look at some innovative educational resources, because whatever we educate to the families in the hospital settings, sometimes it doesn't last long in their mind. So we need some access. Whenever they want, they can access the educational. So these are the things we were kept in mind. So IDEAL is one of the advanced diabetes educator programs specifically for type 1 diabetes for both adult and children. So we needed, as we know, the pediatric diabetes educators were very sparse in our country, so we started working on it. There was no dedicated diabetes educator course in India, little formal awareness of dealing with limited sources. And when COVID happened, we all got adapted very quickly to the virtual platform, how to use it and how to make good use of it. So we were looking at something which is virtual, high quality, affordable, accessible, replicable, sustainable, and which is very appropriate for limited resource settings, which is India. And this is, we started in 2021. So this is our initial core committee. We're all from different parts of India. This is all. We have around 70 plus faculties which include both adult and pediatric specialists. And we have completed almost 11 batches now, and we have certified around 254 educators so far from different parts of India. And we also got award from the ISPAD, which is the Global Society, as an 2023 prize for innovation in pediatrics diabetes. And our services, this project was also published in Nature, Hormone Pediatrics, one of the reputed journals as well. Then this was more advanced for educators. Then we wanted to do something which is very basic for parents caring for the children, or healthcare assistants, or somebody who just wants a very basic knowledge. So we started this again an online course called BEST, which is Basic Education Series in Type 1. So this is a 4-week course, and which is around 8 hours in total. So we have completed around 12 batches and trained around 440 participants so far. Then going beyond that, so school was another challenge where awareness was less and children were facing a lot of difficulties during exams. So we, in collaboration with National Commission for Child Protection in Children, and issued a directive to all educational boards saying that children with diabetes should be given access to the diabetes supplies during exams, especially CGMs, insulin pumps, and glucometer. And this became a mandate, and following this, many boards like CBSE, state boards, started sending circulars to all the schools to accommodate these requirements. So this was a big step in our movement. Then we did that, but a lot of school teachers or school staff were not aware how to handle these children with type 1 diabetes. A lot of times children being denied admission, children being denied, denied parents visiting schools to give the insulin to the children. So they were lacking confidence, they were lacking awareness how to manage. So to address this, we did pre-recorded videos in different languages, which is called IDEAS, which stands for Initiative for Diabetes Education and Awareness for School. And this is around 60 minutes video where it shows the school staff what is their role in managing the children, how they can help the children to have a healthy life in school, and how to overcome managing hyperglycemias in the school or sick day management. And since the era of social media, there were a lot of misinformation on the social media influencers, which was confusing families about managing type 1 diabetes. To overcome this, we brought Triple M, which is monthly busting messages. So every month we release one short message trying to give the right information to the public and within our networks, and also on the social media handle. So far what we have done is, we have done something which is appropriate for limited resource settings, very high quality, affordable, accessible, replicable, and sustainable educational resources. And these are all our efforts so far. So this was at our national level. So what I'm going to talk about next few slides is what we did at our institution. So we are trying to build a future, expand our capacity to care more children. So this is the chronology of our department. So exclusive pediatric diabetes services were started in 2024. And at that point, we had around 40 children with type 1 diabetes under our care. And that number today stands around 1,600 who are registered with us for with children with type 1 diabetes. And it's a significant growth if you see. So October 2014, we started having a children benevolent fund. We started, a lot of donors came forward contributing their money to the fund. And we used that money to buy simple things like syringes and strips to give to the children. And we moved to the new campus, which is a blessing for us. We had a lot of space and amenities there. And we started partnering with a lot of NGOs like Rotary, Happiest Minds, PPHF, Buddhista, Novo Nordisk Education Foundation, Biocon. And we were the first center of excellence from Novo Nordisk Education Foundation program. And we got all our 5 dietitians trained with pediatric training for type 1 diabetes and we're certified. So they all have, standard knowledge to look after them. And 2023, we brought a Kannada channel called Sakkare Guru, and we have 13 educational videos in Kannada addressing hypo management, sick day management, insulin technique, using glucometer, myths and misconceptions, so and especially diet as well. So this is where we stand now. We are around 1,560 children with type 1, 117 with type 2 children, and we have monogenic diabetes around 30 children. So this is one of our events which we participated, conducted by Happiest Minds, and we were able to raise 10 lakhs rupees from 5 kilometer running, and all these children who are with type 1 diabetes ran with us for 5 kilometers to raise the funds. I'll just take 2 more minutes because I just want to. So strategies we adopted to achieve our objectives. So as we know, poverty, ignorance, poor follow-up, lack of educators, unstructured counseling, all this was lacking. We always moan about this, but something has to be done somewhere, and we were fortunate that we had opportunity to do something on this. And we needed innovative measures to reduce the financial burden, improve their self-management skills, and empower them and show them a better quality of life. So we started doing annual diabetes event once every year in November. Basically create a platform for parents to interact with each other, kids to interact with each other, make them feel empowered, make them feel they're not alone in this journey. There are a lot of people along with them, and also show them there are a lot of people behind you to help you. And so it's just a psychological approach to make them feel, confident. And we also, sometimes we invite the T1D champions. We call the champions because these are the children who have become adults, growing with type 1 diabetes, who have reached very good career in their life. And they are the good role models for other children to show that, diabetes is not the end of life, and there's much more than diabetes. Everybody have potential to achieve their, best of the career, and just have to manage their health optimally. So these are some of the activities during our annual event. So the annual event is just not knowledge sharing, it is fun, networking, having a lot of entertainment. Then we were also blessed to be introduced to Make-A-Wish, and my very good friend Dr. Arvind is here from ISRO. He was the one who connected us to Make-A-Wish India. So this is an organization which fulfills child's wish, any child who is living with chronic illness. So they can wish 3 things, and one of the wishes will be fulfilled. So far, around 400 children's wishes been fulfilled, and a lot of things like cycles, laptops, smartphones, notepads, cricket sets, meeting football captain of India, meeting Kapil Dev, becoming a forest officer for one day, becoming a policeman for one day. So many different kinds of wishes been fulfilled. And we believe that this will bring a lot of smiles to the grief-stricken faces of kids and their families. And this is some of the pictures showing kids having happy faces with their gifts and excited. We have a WhatsApp group. All our families are in this, around 800 members. So basically it is to communicate with each other about any new developments, any programs, any talents which children have achieved, so that it just encourages the other children to do more. And this is one of our dietetic counseling room, very child-friendly. And we have 5 dietitians who've been certified, who look after children with type 1 diabetes, and one of the dietitians being sponsored by Novo Nordisk full-time. They've been with us for 2 years, and they pay this, Novo Nordisk pay the salary, but they work for us. As I said, educational resources was the other thing which we were working on. Initially, we made a handbook, both in Kannada and English, which is called Living Well with Diabetes. We hand over this to free of cost to all the families with type 1 diabetes. And we do monthly small group teachings. And Sakre Guru is our YouTube channel, and you can access this channel on our website, or you can go to YouTube and just say Sakre Guru. These are all in Kannada, so it was specifically done to meet the needs of our state. So the financial respite and insulin and the cost of managing the diabetes is becoming more and more expensive over the years, and families almost 1/3 to 30 to 40% of their income is been spent on one child's care. So realizing this, we made a MOU with a lot of NGOs like Rotary, People to People Health Foundation, Happiest Minds, Uttishta, Hidayangal, Unnadam, so many more to name here. And so far, we've been able to support more than 400 families for last 3 years with all the diabetes supplies free of cost, which includes best standard insulins like analog insulins, glucose testing strips, and needles. Last 2 years, the total value of diabetes supplies provided through the help of NGOs and CSR partners is close to 2.1 crores. So it's a huge amount which has been supported to the children. And with the help of the NNEF, Uttishta, and Diabetes Club, around 38 kids received part of their school fees and expenses. And the most important thing is we've been having multiple meetings with the government to support these underprivileged children, because whatever we do in a long run, we don't know how long it might be sustainable, but coming from a government project might go for a long run. So it is in the process, and you might have seen in the newspapers already the government has announced it, but it's just yet to get executed. And this is one of the photos with our CSR partners. So ambience was other thing. Why only corporate hospitals should have a nice ambience and children should have? Why can't a government institute have a better ambience? So with this, we joined hands with NNEF, and they were able to bring about some changes. A mini library for children, play area, and phlebotomy area where the children get blood tests to make sure they are in a pleasant environment. We have a dedicated breastfeeding room and dedicated educator counseling room. And there are support groups within our children who parents meet each other every once in a month on a Sunday in the Kabban Park. They go for a walk, have a breakfast, gossip with each other, learn from each other, and support each other. So this is our educator counseling room. This is our play area with a mini library there. And this is our phlebotomy area where just to make them feel good and, so that they forget the pain of giving a blood test. So we believe all these measures over the years and many more to planned in the pipeline. We've been able to reach out to many families with type 1 diabetes, providing best of care and the most affordable cost, becoming one of the largest premier centers in our state and probably in India under the government arena. I wish to thank our institute director, all the previous directors, my colleagues, my supporting staff, the families with type 1 diabetes. Without their support, we could not have progressed with our care and services. And I'm just showing some gallery of pictures. These are the events which we do, walkathon, activities for children with coloring, games, a lot of physical entertainment games. And even during the COVID, we were able to do some virtual programs. And on your right side bottom, few kids received insulin pump as a part of the CSR project. And this is our inauguration of the pediatric department, and children, lighting the lamp. So we believe we have many more miles to cross, because we need more pediatric faculties because numbers are going up. We need a dedicated nurse. We have educators and dietitians. We also need a nurse to help us with the endocrine department. We continue to be advocacy along with the families to the government to support these children with type 1 diabetes. and improvise and strengthen the existing services, and psychological support and social worker, which is lacking in a comprehensive care team. So we're hoping sometime this can also be achieved. I thank all these CSR and NGO partners who have joined hands with us in this journey and made us feel good, and also made us feel we have to work more towards them. God's grace, my directors, colleagues, friends, support staff, well-wishers, and type 1 diabetes, we've been able to achieve this. Not to forget the last, this gentleman, most of you know, Dr. Nasim Shetty, who was the founder director of our institute, with his vision and dedication, who gave us this fantastic institute, and which is carrying that legacy, and we always pay our gratitude to him. And thank you.
You want to have say something? Yeah.
Yeah, definitely. And before I say anything, first of all, I would like to stand
Please.
up and I would request everybody in the hall.
Phenomenal work. Hats off to you and your
This
team.
is something which is massive. It's our work. We diagnose type 1, we just refer. The background work, what has been done, and throughout means the patient, the families, the government, the NGOs, everybody encompassed. It's a massive work. It's really means
Amazing, sir.
kudos to all your team and Dr. Satyanan. It's really, really a wonderful job. I don't have words further to say anything.
Manohar, you wanted to tell something?
No, that's what.
No, it's always
phenomenal work. Hats off to
No,
you.
really I'm humbled with that words, but I think it's a collective effort, and I'm sure many of you would have helped some way, directly or indirectly, either referring a child or directing them to us or showing them the right thing. It's a teamwork collectively from all of us, each and everyone. So it's appreciation to all of us. I think it's not one person, my institute, my team, and all of you. Thank you.
Thank you. Thank you. Santhosh, it's been a pleasure to chair this
Thank you.
session.
It was a pleasure to be here. Thank you.
Thank you.
Thank you, Santhosh.